Good afternoon, everyone. Thanks so much for participating today in the electronic visit verification public meeting. Just some reminders about today's meeting that all phone lines are muted. If you have any questions, please submit those through the chat feature. We will not be answering any of the submitted questions during today's presentation. You'll see in the next slide that we do have quite the full agenda for today's session. Any questions that are submitted will be addressed after the presentation through updates through the frequently asked questions, which are posted on the DHS EVV website. And when you are submitting your questions, please make sure to reference the slide number if it applies when you submit that question. It just helps us in identifying the true issue that you're asking about. So the agenda for today's session, we're trying to put all of the new information that we have for you up front. We have the general DHS EVV program updates, home healthcare services EVV implementation updates, EVV personal care services reminders, and PCS system updates. We also have the PCS data updates, PCS manual edit compliance. We'll have some information from the Bureau of Program Integrity, or BPI. We'll go over a few of the frequently asked questions that we've received and continue to receive. And then we'll also just really quickly go over the EVV context, which we have gone through before, but just want to highlight those yet again. So with that, we're going to get into some of the new content that we have related to our DHS EVV program. And the biggest thing that we have for you is that the alternate EVV technical specifications or DHS EVV programs were released on March 30th, or last week, and they're now available on the DHS EVV website. As a note, this does not apply to DHS EVV system users, so this is only for those users of alternate EVV or third-party EVV vendors. Quick note that this is really important that you understand that these new tech specs are out there, because we collapsed the previous alternate EVV tech specs into one consolidated document. So there's now only that one document that vendors are supposed to be reviewing and coding to. We did this not only to address some feedback from CMS that we received in order to become fully compliant with the Cures Act, but also to address some of the business requirements for home health implementation. So vendors will need to review these new specs and make changes for all DHS EVV programs, and that includes for both PCS and home health. All previously certified vendors will need to recertify with the new specs. Providers will need to make sure your vendors are completing this. And we also have quick reference guides for both the certification and recertification steps, which will be available on the DHS EVV website, if not later today, then first thing next week. So it's really important that all EVV vendors understand that they are required to certify or recertify for both PCS and home health programs. There are no exemptions for recertifications, and there are new requirements, again, for both of the programs. A vendor's failure to complete the certification or recertification process will risk full file rejections once the new requirements are enforced. And DHS is targeting to enforce these requirements effective August 10th, 2022. So previously we had communicated that the targeted date was June 15th. We have just actually, as of today, made the decision to actually push that date back to August 10th to allow some additional time for certification and recertification. This date also pushes back the soft launch start date for our home health implementation as well. So really important that everyone understands that the June 15th date that was previously communicated has been updated, and it is now August 10th. So once again, the new alternate EVV technical specifications are available on the website, and they were released March 30th. On April 15th, the PA Alt EVV support team will be sending out the information to the EVV vendors currently in the program for the recertification process. Then beginning April 18th, any new EVV vendors can start reaching out to the PA Alt EVV support team to begin the certification process. For SANDATA agency management system users, the PA Alt EVV support team will be reaching out directly to those users. So as previously stated, there are two pathways for vendor certifications. The first is the vendor recertification, and that's for vendors who were previously certified in the PCS EVV program. These vendors will receive an email directly from the PA Alt EVV support team detailing the process to recertify. Those emails will be sent by the PA Alt EVV support team on April 15th. And please refer to the PA-DHS Alternate EVV Quick Reference Guide for recertification. That will be on the website later today or first thing next week. The second pathway is for new vendors, and this will be for certification. So these are for vendors who were not previously certified for the PCS EVV program. So again, we're talking completely new EVV vendors to the PA-DHS EVV program. So new vendors have a different pathway to certification than vendors previously certified. They must have at least one PA provider agency client in order to go through the certification process with the PA Alternate EVV support team. And as stated previously, we will have that quick reference guide for new vendors that should be on the website later today or first thing next week. So please, if you are a new vendor, make sure that you are reviewing that quick reference guide and not the one for recertification. So the DHS aggregator is always available for testing during the certification process, and that is except during standard release windows. The PA Alt EVV support team can assist with testing results and validation. As far as the duration of testing, that does vary. For recertifications, we're estimating 2 to 4 weeks. And for new vendor certifications, it should be 2 to 6 weeks. Please note that testing should continue until the data is sent error-free. And then once the testing is complete, we encourage vendors and agencies to take the time to meet and ensure that your data is accurate in the DHS aggregator. If you are a new provider to the DHS EVV program, on or after April 15th, please make sure that you go to the DHS Alt EVV webpage to fill out a new provider enrollment form. This form is going to initiate your agency receiving their credentials to the DHS aggregator. Once completed, you will receive an email response providing your agency with the next steps to receiving your agency credentials. And we do have a list of the EVV vendors who previously completed the certification process with SANDATA that is still available on the website for any provider that wants to check out that list of existing EVV vendors. So new home health fee-for-service providers who have completed and submitted the new provider enrollment form once it's available via the DHS Alternate EVV webpage and have questions specific to Alternate EVV can contact the SANDATA Alternate EVV support team, and that information is included here on the slide. The phone is 855-705-2407, and the email is paaltevv@sandata.com. To assist with any frequently asked questions surrounding Alt EVV in the DHS program, SANDATA will be holding 2 town hall events. These town hall events are intended for vendors, providers, and MCOs. The first session is this coming Monday, April 11th from 1 to 2:30. There is the registration link included here in the slide. The second session is scheduled for Friday, May 27th from noon to 1:30. Just a note here that both sessions will have the same content, But we encourage you all, if you are interested in this, to attend the first session, which is this coming Monday. The topics that will be part of the town hall sessions, again, for both of those dates, are the specification and JSON review, including client payer child segment, provider identification qualifier, employee identifier. They'll also go over visit overview, changes to the calls segment data elements for Cures compliance, services and modifiers, common support issues, integration best practices, and tips for services requiring multiple caregivers. So all of these topics are slated for discussion and presentation at the upcoming town hall meeting on Monday. Just a reminder here that if you are using alternate EVV, providers need to ensure that the alternate EVV system captures all 6 required data points and can interface with the DHS aggregator. The Cures Act requires that EVV systems must collect and verify these 6 data items, which is the type of service provided, the name of the individual receiving service, the date of service delivery, the location of service delivery, the name of the individual providing the service, and the time the service begins and ends. So just again, make sure that you review the alternate EVV tech specs and the quick reference guide on vendor credentialing, both available on the website. And then also just a note that we have updated the error handling overview and reference guide for all EVV, and that is also available on the website. So because we do receive quite a few questions related to the DHS aggregator, we just want to make sure that you do understand that it has read-only views and reporting in order to help you monitor all the visits your vendor delivers for both PCS and home health. The DHS aggregator compiles the visit data for provider agencies to review, but it does not submit claims. This is a biggie. The DHS aggregator is validated against during claims processing when an EVV service is found on the claim transaction. And again, billing processes continue as normal. So we do have some additional public meetings that we have scheduled for the rest of 2022. The first one is June 24th from 1 to 2. We have another one in September and then another one in December. The registration links for those public meetings are on the DHS EVV website, and I'm sure that we will send those out via a listserv communication closer to those dates. We also wanted to note that the website format has been updated to break out information for PCS versus home health. So hopefully that is helpful to you finding the correct information that you need. And finally, for this section, we wanted to note that CMS did approve certification of the DHS EVV system, and that certification enables PA to harness some enhanced federal funding to help finance the development of the DHS EVV system. So major kudos to the EVV team in getting that done. We also wanted to note that CMS has shared recently that states will have the opportunity to apply for a good faith effort exemption extension for home health care services implementation. We have not seen any information yet on what the criteria will be for that good faith effort exemption process. If Pennsylvania meets the criteria, however, we will definitely entertain applying for the 1-year extension for home health implementation. With that, I will turn it over to Ellie.
And with regard to home health services EVV implementation, the 21st Century Cures Act mandated that states implement EVV for home health care services by January 1st, 2023. The department intends to similarly provide a soft launch period targeted to start in summer 2022 where Home Health Care Services EVV error status codes will set in a pay and list disposition prior to January 1st, 2023. For claims that contain Home Health Care Services during this time, MMIS will perform validation against the EVV aggregator to determine if the information submitted on the claim matches the EVV PCS visit data stored in the EVV aggregator. However, EVV error status codes, ECSs, will set without impacting claim payment. During this period, the claim will continue to successfully pass DHS EVV validation and process through the normal claims adjudication process. The department issued a provider notification letter in July 2021 identifying the required services and next steps to begin the implementation process. The department published a list of Medicaid state plan and waiver services identified as home health care services that are subject to EVV. This list is available on the DHS EVV webpage. Home health care services requirements are anticipated to be provided in an MA bulletin targeted for issue by June of this year. Home health care services providers need to determine whether to use the DHS EVV solution or their own alternate EVV system. Technical specifications for alternate EVV providers are now available and have been posted to the DHS EVV website. The list of alternate EVV vendors currently used for PCS and may also be able to support HHCS is available at https and the rest of the website. Home health care services providers who also provide PCS should start working with their vendors to prepare to integrate for the home health implementation. If using the DHS EVV system, providers will need to complete training and receive login credentials. The free DHS EVV system is available for use for fee-for-service providers only. This includes ODP, fee-for-service, OMAP, fee-for-service, and OLTL, fee-for-service. This includes both PCS and HHCS. The free DHS EVV system cannot capture visits for any MCO participant or member. Please contact the appropriate Health Choices or Community Health Choices MCO for EVV processes for those in managed care programs. Training dates, locations, and enrollment information for new users to the DHS SANdata EVV system is forthcoming. If you use an alt EVV vendor, you do not need this training. Home healthcare services EVV implementation updates. Training for agencies opting to use the free DHS EVV will begin prior to home healthcare services program launch. A variety of training channels will be available: in-person classroom sessions for administrators, instructor-led webinar sessions for staff, self-paced training accessible 24/7, delivered via SANdata's Learning Management System, or LMS, self-paced training accessible 24/7, offering a full range of functional video snipped via SANdata on demand. Steps for completing EVV training. Agency administrators will need to complete the 2 required courses, Overview and Security in the SANdata LMS. The LMS registration link will be provided in future communication. After the agency administrator has completed the required courses, they will receive an automated email, which will contain links to the SANdata Webinar Center and to SANdata On Demand. The Webinar Center, GoOnceHub.com, which will provide a listing of instructor-led, role-based webinars for the agency administrative staff to attend. SANdata On Demand at the following website link, which contains a full range of recorded, self-paced video snippets on EVV functionality for the staff to review. In-person training is also available for all new home health care services agency administrators that would like to attend a hands-on session. A classroom registration calendar will also be provided for registration and future communication. Administrators may choose one of 3 separate full-day sessions in the Harrisburg, Pennsylvania area. Those wishing to attend in-person sessions will be able to do so through the SANdata Webinar Center. at the go.onehub.com. And please note, prior to Home Healthcare Services Program launch, agencies will be receiving communication regarding the DHS EVV system training with all the pertinent webinar center links, as well as dates, times, and location of the in-person training. Once the updated training has been activated 48 to 72 hours, upon completion of the 2 LMS administrator security courses, the first agency administrator who completed the section will receive the provider agency's credentials. The agency credentials are delivered in a welcome kit, emailed to the user's registered email address in the LMS system. Only one set of credentials are delivered per agency. Credentials are delivered via secure email. Please check your spam and junk folders. Partial contents of the welcome kit email are encrypted. When the welcome kit email is sent by SendData, the recipient will have 10 days to open the email. Once opened, the recipient will have 10 minutes to access the code to open the secure contents. It's important to open the welcome kit email timely to avoid requesting it to be resent. The welcome kit is an email that contains the following information: encrypted welcome letter containing important next steps and instructions for using EVV, including agency-specific login credentials, URL, username, and temporary password to access SendData EVV database. The login credentials contained in the welcome kit will also allow the agency to input the direct care workers, as well as set up additional agency-level staff to view and manage EVV data. 2 agency-specific call reference guides containing SandTrax toll-free phones, one for group visits and one for non-group visits. CRGs contain step-by-step instructions to direct care workers on how to check in and out using telephonic visit verification, or TVV. PA service list, please always check the Pennsylvania DHS EVV website for updates to the PA service list. While multiple provider representatives from the same agency may complete EVV training, the welcome kit email will be emailed to the first identified provider agency representative email address on the training registration and completion reports. When agencies receive their welcome kit emails, they should begin to data enter direct care workers into the SendData EVV, add agency EVV users, add clients, and become familiar with training documents and train their agency's employees. Training administrators using SendData EVV system delivered via in-person classroom sessions. You can see the training topics listed there and the descriptions and the scope. To keep current on the EVV home healthcare services implementation, please refer to the PA-DHS EVV website at the following website link. Home healthcare service providers are strongly encouraged to request to be added to the EVV listserv by sending to an email to the RAPWEVV notice@pa.com, making sure to include the provider name and email address.
Okay, thank you, Ellie. My name is Janice Bickle. I work in the Office of Long-Term Living in the Bureau of Policy Development and Communications Management. And we're going to talk now about electronic visit verification, personal care services reminders, and EVV personal care services system updates. As a reminder, the SendData release schedule has been now made available on the DHS EVV webpage, and it can be found under the EVV implementation updates header of the personal care services page. And it looks like it's your first option under the page, and you'll see a little new asterisk there. SendData communicates via email to provider agencies when staff need to log out during system outages. Providers should review notifications prior to releases and inform their staff when they will need to be logged out of the system. The SANDATA customer care portal is accessible to find the release notes and can be found via the link found at https://sandata.zendesk.com/hc/en-us. So for providers who are using the DHS EVV system, they should remind their direct care workers to update the SANDATA Mobile Connect or SMC application immediately following a SANDATA mobile application release. Staff are to communicate with their administrators on issues with SMC and/or telephonic visit verification. Administrators should reach out to the Provider Assistance Center or PAC only when they cannot find resolution to SMC password resets. It is highly suggested that all agencies who are using the DHS EVV system have at least 2 EVV administrators on their staff in the potential event of the primary administrator's unavailability. As a reminder, ODP fee-for-service providers need to reach out to their support coordination and service coordination entities to ensure the program diagnosis code is stored in HCSIS for the individual. This enables the DHS EVV system to automatically receive client updates. The HCSIS authorization files will need the diagnosis code to upload into the DHS EVV system, or errors may occur. The program diagnosis code is now a required field for newly created individual support plans or individual service plans, and in HCSIS for ODP as well as for OLTL. This update ensures HCSIS authorization data will be loaded timely into the DHS EVV aggregator. Okay, another update is a T1019 systems notice was shared with the managed care organizations. It is anticipated that an MA bulletin will be issued later this month, and the public notice will be published April 16th, 2022, announcing these updates. Encounters posting ESC 927 or ESC 928 are now setting in a denial disposition for community health choices for dates of service on or after January 1st of 2022. Systems notice SYS-2021-012 CHC ESC disposition update was previously issued related to this. Encounters posting ESC 927 and ESC 928 for dates of service on and after June 1st, 2022 for physical health will set in a denied disposition. Systems notice SYS-2022-006 was previously issued related to this. So SANDATA is working on updates to the DHS EVV system and the DHS aggregator to incorporate the PA DHS updates targeted for August 10th, 2022. No actions are needed right now by users other than additional training mentioned previously. DHS EVV systems users should expect SANDATA to include updates made to support home healthcare services in the release targeted for August 10th, 2022. Personal care services providers using an alt EVV to submit EVV data should be aware that PCS claims, as well as encounters submitted after August 10, 2022, will need to adhere to the updated technical specifications. If they're not, they will be denied. And do we have a representative from Sandata to talk about alternate EVV tips?
Sorry, Janice, this is you as well.
Aha. Okay, well then let's talk about some alternate EVV tips. Okay, so the first questions a lot of people ask are, why do my visits get rejected? So an all EVV visit record may be rejected for several reasons. The first reason could be the client was not found. So the client must be in the system as well as active before a visit is accepted. So the second reason that we find is that the visit date is out of range. So the visit might be older than the account creation date. The third issue we've seen is worker not found. So the worker must be in the system as well as active before a visit can be accepted. The fourth reason we've seen is schedule past due. This means they cannot update schedules that have occurred in the past. The fifth reason we found is row is not found. That is trying to update or delete a record that doesn't exist. Okay, a sixth reason for visit rejection is hours exceed maximum hours allowed. So this happens when a visit sent is more than 24 hours. And I think we have some more details in a further slide to talk about overnight issues. The seventh reason is visit date is empty. So the date information is insufficient. The eighth reason is version number is duplicated or older than the current. So that means that the order of records is unknown. Okay, so let's talk about claims validation troubleshooting aid. To assist in fixing issues associated with no matching EVV PCS visit found or error status code 928 and PCS units billed exceed units verified in EVV, which is also seen as ESC 927, DHS has published the EVV ESC guidance document. DHS has recommended agencies review the EVV ESC guidance document on our DHS EVV website for information related to resolution activities before you reach out to your vendor for support. The EVV ESC guidance document is located on the DHS EVV website, and that link is provided below. So please make sure you review all documents as well as speak to a program office or MCO representative before opening a support ticket with Sandata or your MCO's aggregator vendor. Okay, here are some DHS provider resources. The Sandata EVV Customer Care Portal, also known as Sandata On Demand, can be found at sandata.zendesk.com. The Sandata EVV Training Video Library can be found at the link below. And the Sandata Learning Management System is available for administrators at sandatalearn.com. And then we have, as stated many times, our DHS EVV webpage, which is at this link. And it includes DHS EVV Sandata training manuals, DHS EVV medical assistance bulletins, DHS EVV frequently asked questions, which are updated when necessary. And it also has the ODP EVV technical guide.
Great, thanks, Janice. So now we're just going to have some data updates related to personal care services. This is something that we do each of the public meetings just to give you guys some heads up on what we're seeing on our end. So the first one is the system availability. During the first quarter and calendar year 2022, the PADHS EVV system had an average system availability uptime of 99.9%, which is great. In the last 2 months, there were no system outages outside of scheduled maintenance. Kick to you, Janice.
Okay, thanks, Britt. So we see here on this slide progress made on our EVV compliance from January 17th of 2022 all the way through March 27th of 2022. And it looks like most of our fee-for-service providers in the OLTL system are having the bulk of their visits in an error status code of 925, which is what we're looking for. We did have a small dip in February due to some technical issues, but the compliance rate did increase the further along as time passed, and so it looks like everyone is at a higher compliance rate and doing well the further we go away from January. So keep up the good work, providers.
Sorry for the slides going back and forth here, guys. I'm trying my best to multitask. So for ODP EVV ESCs, since January 17th, Promise found matching EVV visit records for nearly 93.4% of ODP personal care service details processed. 2.8% of the ODP PCS service details set ESD 927, indicating the units billed are greater than the number of verified units in the DHS EVV aggregator. And 3.8% of ODP PCS service details set ESC 928, which is that no matching EVV verified visit found at the time of claims processing. We'll shift to China, I believe.
Good afternoon. OMAP fee-for-service claims. Although we see claims are continuing to hit the 927 units not found and ESC 928 visits not found, we are still continuing to see the majority of the claims have been found and are verified in EVV. So I would just like to ask the providers to please continue to keep up the good work. Overall, I feel that we are doing well. Next screen, please. This section is the EVV PCS manual edit compliance section. DHS is assessing EVV manual edit compliance for fee-for-service. At this time, DHS is assessing manual edit compliance rates by program, payer, ODP, OLT, and OMAP. As a reminder, providers are expected to achieve at least 50% of EVV records for verified visits without manual edits. If an EVV visit is missing information or the EVV visit information was entered incorrectly and requires any type of edit or correction, this is deemed a manual edit. If a provider manipulates data or adds missing data or changes data in any way after the service is delivered, this is deemed a manual edit. Example of manual edits include, but are not limited to, the following: a caregiver missing a clock in or clock out, and the visit needs to be edited to add the appropriate time of service. The visit is unable to be electronically captured at the point of care because the mobile application and the telephony are not available. The EVV system is down. The visit is unable to be electronically captured because a device cannot be used at the point of care. A visit is captured electronically, but causes an exception to be generated. The records would be classified as a manual edit. The department is performing targeted outreach to provide technical assistance to providers that have either not submitted EVV data or have a high percentage of manual visits. Providers should self-monitor their EVV compliance at this time and work to improve areas of non-compliance. DHS is working to develop a user-friendly compliance report in the DHS EVV Aggregator Portal and EVV Provider Portal for providers to efficiently determine their quarterly compliance percentage. This is targeted for release on August 10th, 2022. DHS will be reducing the manual edit compliance rate threshold in the future. DHS is developing an updated MAB to reflect the new manual edit compliance rates. OLTL manual edit and compliances. OLT is sending letters to providers reflecting each agency's first calendar quarter compliance rate of 2022, alongside the agency's quarterly compliance average for 2021. Providers with a high level of manual visit entries or edits, over 50% during the first quarter of 2022, must respond to OLTL with their planned corrective action. OLTL will be pulling provider compliance reports regularly to ensure that providers are following their stated corrective action and the provider's manual visit entries or edit compliance rates are improved. QMET staff will be reviewing EVV visits as part of their regular monitoring process and working with providers to help improve any EVV compliance issues noted. To ensure DHS can appropriately contact providers, please make sure legal entity information, including contact information, is up to date and correct in all DHS systems.
Good afternoon, this is Beverly Croft. I'm going to go over the Bureau of Program Integrity. And we're going to start with the next slide. So the purpose of the Bureau of Program Integrity is to protect the medical assistance program and recipients to ensure they receive quality medical services, as well as prevent those recipients from abusing those medical services. We evaluate medical services provided by all providers and apply administrative sanctions such as recover overpayments when appropriate. We also refer cases of potential fraud to the appropriate law enforcement agency. BPI identifies issues for review by investigating any act or potential fraud, waste, or abuse committed by recipients, employees that may in fact affect the integrity of the Medicaid program. We also look at quality issues that may affect the MA consumer or recipient's health. In any egregious situation, the department has defined an egregious situation as a situation that is causing or may cause harm to a member or significant financial loss to the Department of Human Services or managed care organization. BPI is a team of medical professionals specifically trained to identify and take action against fraud, waste, and abuse. So what is fraud, waste, and abuse? Can we go to the next slide? All right. BPI reviews, like I said, all recipients and caregivers and provider types for possible fraud, waste, and abuse. And fraud's absolute definition is knowingly submit or cause to be submit false claims or making false misrepresentations of fact to attain state or federal healthcare payment for which no entitlement would otherwise exist. Waste is overutilization of services or other practices that result in unnecessary cost. This is not considered a criminal action, but rather a misuse of resources. Abuse is practices that either directly or indirectly result in unnecessary costs to the Medicaid program. Abuse includes any practice not consistent with providing patients with services that are medically necessary, not rendered to the patient, and or does not meet the professionally recognized standards. So how BPI does this is we actually, even as a team, we work internally with other program offices within DHS, such as Office of Long-Term Living and the Office of Developmental Programs. As a team, we maintain communication to better strengthen the MA program, and we exchange information and research all complaints and referrals from these offices, and as well as outside sources. And in turn, we notify Office of Long-Term Living and ODP of any instances of fraud that we've had to refer to the Attorney General's office. We also, moving to the next slide, work with, there we go. We also collaborate with outside entities, including the Medicaid Fraud Control Section within the Attorney General's office. The state and federal law enforcement offices we also work with include the offices of Inspector General as well as CMS. Our collaboration with law enforcement in the Medicaid Fraud Control Section is to support criminal investigations of fraudulent activity. So what is the difference between BPI sanctions and criminal sanctions? Defined in the next slide, BPI handles civil sanctions. Civil issues are billing or coding errors. The administrative sanctions BPI takes includes collecting overpayments. We preclude providers from the Medicaid program, which results in federal reporting. We also will implement a payment suspension in the face of a credible allegation of fraud. The one part that we do support the Medicaid Fraud Control Section with is we support their criminal cases by preponderance of evidence to help them prove beyond a reasonable doubt. BPI does not determine fraud. The Medicaid Fraud Control Section's focus is criminal intent and criminal prosecution, but they rely on us to provide that evidence. So next, we wanted to give you a little bit of information about if you're contacted by BPI, what we're looking for when we are doing a review of direct care workers and personal care attendants. We will ask for the complete medical record or complete record, and that includes these items here, which is the attendant, whether it be direct care worker or PCA, their application, the complete agreement between you and the direct care worker and PCA. If that caregiver was terminated, we want to see that form. We also want to see all the service orders, plan of care, and all documentation of the services provided. We need to see the timesheets for all the services and EVV submissions, including the supporting documentation for your manual entries. Definitely, this is a big takeaway. Remember, you have to have supporting documentation with your manual entries in EVV, and BPI is going to be looking at those. We look at all of the paid MCO and fee-for-service claims, so we look at the entire picture. And what can you do? If contacted by BPI, first and foremost, educate yourself on all of the guidance with the use of EVV, with the use of home care services, all the rules, all the regulations, all the billing guidelines. After you have educated yourself, you need to also educate your caregivers and billing staff, as well as the participant. It's important that the participant understands that you are following the rules and regulations and guidelines, because they also can tend to go wayward. You also want to make sure that you evaluate the accuracy of your EVV submissions and claim submissions. Before you enter it, make sure it's accurate. If you receive a letter from BPI, follow all the directions within the letter to the best of your ability. And send in all supporting documentation as requested. And that, again, includes supporting documentation for your manual entries in EVV. At the end of each letter, there will be a contact BPI representative there, and you will want to reach out to them with any possible questions that you have, and make sure that a line of communication is open. If you do not respond, we do not stop our action, we proceed, which will often ends in you will be cited for an overpayment for not supplying the records. So that's pretty much what I wanted to go over for BPI. And if you have any questions, you can definitely pose them to the group. Thank you.
Okay, thanks so much, Bev. I'm going to talk about frequently asked questions that have been coming across to our department recently, starting with overnight visits. So questions that have come across: for visits submitted to the DHS aggregator that span across midnight, can it be one check-in and check-out, such as checking in at 10 p.m. and checking out at 6 a.m., or must it be two separate shifts, such as 10 p.m. to 12 a.m. and 12 a.m. to 6 a.m.? So the answer to that is when you're submitting EVV visit records to the PA-DHS aggregator, the visit does not have to be separated simply due to the visit spanning midnight. The limitation in the DHS EVV aggregator is that a visit, such as a clock in and clock out, cannot exceed 24 hours. It is the agency's discretion and depends on the agency's timesheet tracking policy. Another overnight visit question that we've received is, can an overnight shift be sent as one full shift, or must it be split for authorization purposes? The answer to that is when filing a PA-DHS claim for an overnight shift, the provider should go by the from date of service, such as the date associated with the visit clock in time. For more specific details, specific to billing for personal care services under the Office of Developmental Programs, there is a technical guide on the DHS EVV website that should be referenced. Okay, so let's talk about location capture. A question that we've seen come up a lot is, what is the specific requirement to capture location? And the answer to that is the EVV requirement is that the location be captured electronically. CMS requires verification of location at the start and end of a service. GPS coordinates, such as latitude and longitude, are required for both mobile and fixed verification, or FVV, devices. Location is not tracked throughout services provided in the community. The location should be captured when a caregiver arrives at a participant's house to assist with grocery shopping, for example, and again after they return from the store. The GPS coordinates will be captured in the DHS Sandata mobile application at check-in as well as at check-out. The perimeter for locations is set at 1/4 mile in the DHS SANDATA EVV system. However, even if the recorded location is outside of the 1/4 mile perimeter, this will not cause an exception in the DHS EVV SANDATA system. The provider will be able to enter multiple addresses where services are provided, and these addresses can be updated as needed. If an error occurs, any system errors must be corrected through the web portal by the administrator. Okay, another question we've received in relation to location capture is, what is the specific requirement to capture location for telephony? The answer to that is telephony requires the originating phone number and telephony PIN. As such, telephony may only be used with a landline. So what services are subject to EVV? We've had a question come across that are hospice services subject to EVV. And our answer to that is no, not at this time. Any additional services that would become subject to EVV in the future would be communicated in advance of being subjected to EVV. The most up-to-date list of services subject to EVV may be found on our DHS EVV website. And now we're going to talk about hard copy documentation. So a question we receive frequently is it possible to keep documentation for manual edits electronically? And the answer to that is yes. However, if the documentation is kept electronically, the provider must be able to print that documentation out for auditing purposes. If EVV visits require manual corrections or edits due to missing or incorrect data elements, hard copy documentation of the manual corrections is required for auditing purposes. Hard copy documentation is defined as a paper copy. Providers should establish their own policy on documentation required to meet auditing requirements and standards, as well as organizational needs.
Thanks, Janice. So just really quickly, we wanted to once again go through the EVV contacts. You know, we have gone through this many times before, but we felt that it was necessary to do this once again. For technical issues such as SANDATA account assistance, welcome kit reissuance, or account unlock issues for the SANDATA EVV system, please contact the Provider Assistance Center, PAC, and that information is included here. For issues related to alternate EVV, please contact the PA Alt EVV support team, and their information is included here on the slide, and it was shared earlier in the presentation. For issues related to HHA Exchange and CHC billing, please contact HHA Exchange, and their email is included here, or the appropriate CHC MCO. Vendors needing to integrate with the CHC MCO HHA Exchange should contact the email paintegration@hhaexchange.com. For issues related to physical health MCO claims and billing questions, please contact the appropriate physical health MCO. For general EVV program issues or requests to be added to the EVV listserv, please contact the EVV resource account at ra-pwevvnotice@pa.gov. Any providers with technical issues reaching out to PAC or SANDATA may copy DHS on those emails at the resource account ra-pwevvissues@pa.gov. You know, just a reminder that it's really important that if you want us to know about that, please copy us using that resource account. And then providers with support ticket numbers they wish to escalate with DHS should reach out directly to that resource account for EVV issues. And that is, again, ra-pwevvissues@pa.gov. For billing issues such as why EVV ESCs are setting, what the EVV ESCs mean, and questions about what is in the aggregator, please contact the appropriate program office claims numbers and emails, and all that information is included on this slide. Again, this is not new information, but we felt that it might be helpful to share once again. And that is everything. Apologies for that. The Alt EVV Town Hall meeting is scheduled for Monday. Hopefully you'll be able to join that if it is relevant to you. We have the public meeting scheduled for late June. And also be sure to check out, we'll have further lists of communications in the next few weeks. Thank you again for participating.